Okay, so hi, everyone. Second meeting of the Community Health Needs Assessment 2022 Work Group. As you know, we meet the first Tuesday of every month. Next month's meeting is November 2nd. I erroneously said November 8th in some of my communications, so just make a note of that. All right, let's move along. Our agenda just repeats what I sent to you earlier. The main goal for today is for us to come to a consensus on the individual community health assessment survey. We had some discussion about making changes and perhaps adding a question. So, and we sent you the summary, which explicitly lists that conversation and what we were talking about. And so I'm going to refer to that as we move along and go through the questions. But we have to decide on whether the CHNA stays as is or has some minor modifications at the close of this meeting. So that's our main goal. We're including a timeline for your ease of reference about what's due when. We're going to look at the CBO survey, which pretty much mirrors the individual survey. And we'll talk about the goal and the plan for disseminating that. And again, a reminder, the next meeting's November 2nd. I mistakenly had said November 8th. So please make a note of that. And we'll go to the next. So again, thank you for joining us. Share your name and your organization's name in the chat box. This way we don't have to do a round robin of faces. And to begin with on a little bit of a lighthearted note, because we got a lot to cover in this meeting, I decided that I would open this, and you're probably all going to crack up, but I'm going to do it anyway. Hi, Kristen. I would open this meeting with a little bit of a song. So I took the liberty of modifying the lyrics from All That Jazz, and I'm going to sing a couple of stanzas from All That Chaz. So if you bear with me a minute, I thought this would get us all in a good mood. I just want to close my door so everyone here doesn't think I lost my mind. Close. All righty. So, no laughing, but I thought this was so appropriate. So we all familiar with All That Jazz, you know, that the Bob Fosse play. So here we go. Come on, colleagues, why don't we settle on the survey and all that jazz? I'm gonna run through our suggestions and seek your feedback. And all that jazz, it's a task worth completing. So now let's get going. And all that jazz. Okay, now, and I'm recorded. Oh, come on. I got to see these reactions.
Amazing job.
Doesn't that make this Zoom worth it now? Doesn't it feel good? Anyway, I might reprise that at some point. We'll see. Okay, we got past that. So everybody's in a good mood now. Yay.
Oh, before we move on, Carolyn has her hand raised.
Oh, I'm sorry, Carolyn. Go ahead.
You can unmute yourself here.
Sorry, I was just clapping.
Oh, okay.
I thought you'd enjoy that. Maybe I should perform this for the state, you know, at the next statewide meeting.
Could be the next campaign.
Yeah.
All that jazz.
All that jazz. All right, so here's the timeline. Where are we right now? Today, reach consensus on the CHNA individual survey. That's what we plan to do. And as you can see, and then this is a little bit fluid, right? So as we get nearer or closer to some of these deadlines, we'll adjust the timing, but that's what we plan to do. Our end date is next year, right? The end of next year. That's what we're all striving toward. And so just keep this as a reminder, and we'll update it as we tick off the boxes and add some other tasks. So what's next? Okay, so we're going to refer to does everyone have their meeting summary from our first meeting? If not, we can pull it up. And then we can also look at the actual Community Health Needs Assessment Survey. And we're just going to point out a couple of items from that summary. Let me just get that we need to make decisions on. And one of those items, does everybody see that up on the screen? Yes? Thumbs up? Yep. Okay. So if we look on that summary, second page of the summary, going down to COVID question, we talked about whether we should add a COVID question. We had some discussion about that. We felt that perhaps it might be leading. I'm of the opinion that I believe it probably would be leading, since in the infectious disease or vaccine preventable disease area, there's a choice to add other. And individuals who are now concerned about COVID could perhaps put COVID in that spot. So those are my thoughts. When we look at questions 1 and 2, we talked about adding the option that reads vaccine preventable diseases. I'm having a hard time seeing this. Let me open this bigger here. What are your ongoing health concerns? We have vaccine preventable diseases. There was concern that was more public health speak and would not be understood by the average person who was reading that. So we thought perhaps we could put in parentheses examples, i.e. Flu, we could say COVID, we could say measles, chickenpox, some of the other common communicable diseases, or we could not. We have it listed as vaccine preventable diseases because what we're trying to do is capture the language and mirror what is in the priorities that the state has presented to us. So that's why that's there. So why don't I just stop there and let's make some decisions on question 2, and also whether or not we should add a COVID question at all, or should we just leave the other section in question 1, the opportunity to somebody write in COVID, and they also have the opportunity to write it in other in section 2. So what are some of the thoughts out there? What's, I know Tavora is not on the call, but Selena is. I know Tavora felt that we should leave everything as is, as did Dr. Mirth. Who's on the phone? Not Mirtha. Atha, but I'm never going to say your name. Atha. I think it's Atha.
Asta. Hey, Janine.
Asta from the Suffolk County Department of Health for the integrity of the survey. So what's the feeling among the group? What do we think?
I know I'm not really, one of the members of the group. I'm assisting with running the meeting, but I personally feel that it would be leading to add that either a question about COVID or even listing COVID as one of those vaccine preventable diseases.
Well, you are a part of the group, Brooke, so don't say that.
Thank you. But I understand.
Here's a question from Tish. I would leave it as is. If respondents have COVID concerns, they can include it in other, under other, which I agree.
I agree.
I had one suggestion after talking it over with a colleague of mine.
Mm-hmm.
If we did add COVID, the other thing we could consider is changing it to 4 concerns. And then we could, statistically, weigh it because it's a added concern, and we're asking for 4 instead of 3. The only reason I'm maybe changing my tune a little bit, and I don't know if anybody else has anything to add. Yesterday at the state meeting, one of the things that they said that we should think about adding to the next prevention agenda, community health improvement plan, is our work with COVID. So that's why I'm sorry to throw a wrench into this, but that was one of my thinking. Like, if we're doing this health assessment and nobody picks COVID, you know, how do we even incorporate everything that we've been doing for COVID in our health improvement plan? I don't know.
All right, well, a couple of things. As far as adding it as a fourth choice and then giving it some kind of a statistical weight, we already have weighting on this survey, because many individuals where it says choose 3 only choose 2 or only choose 1, and then we've got to do an X factor and do a weighting. I don't know, I'm not a statistician or math expert, but I don't know how that would affect the entire weighting system throughout the answers. If you put a fourth one in there, and that's the only one that has a fourth one, it also affects the analysis model that was already built. So there'd have to be modifications to that, which would cost money. Not a lot, but there would be some expense incurred. And if it's worth it to do it, we would do it.
Hi, Janine, can you hear me?
Yeah.
Oh, good, because I was I was trying to talk before. So I think either we add a question related to COVID or we leave it as it is. Because as you were saying, if we add it to this question, it affects a lot of things, the weighting, how it's compared to the past, which I don't have a strong feeling about whether or not we actually add a question. If that's very important to people, I think it's fine, because that can always be looked at separately. You know, if you keep the survey as it is and then you add a question, you still are maintaining the integrity of the original survey. So that's my opinion. If people want to add a COVID question, that's fine. You know, I don't need it, but that's fine. You know, I think that it's better to add it than to try and change these questions. That's my opinion. Right.
Well, I think the question to ask ourselves is, why do we want to add it and what do we want to learn from it? Like, why?
I think COVID was the center of everybody's life for a long time. So it would be unusual if someone said, oh no, COVID didn't affect me at all. I think it affected everybody. I don't know what we're looking to find out.
That's right.
A separate question. Like, what do we want to know?
Yeah, that's my question, is what do we want to know? Why would we be asking that? Because I don't know anyone who wasn't.
We would have to ask, you know, people who would like to see a COVID question. Perhaps we could discuss that. Like, what kind of question would we be asking?
I think that asking about a COVID question might be more appropriate when we do the community-based organization summit, because that's the group that had to pivot and eliminate programs and services, stop or switch to virtual, or come up with creative ways to reach their communities.
I think that makes a lot of sense.
I think that might be a more appropriate place to ask about COVID, and that is not a historical survey that we've issued ongoing. It was only done back in 2013. It was not done in 16, and it was not done in 19.
I think that's an excellent suggestion.
Yeah, I think that, because I think that's what we're looking to find out. Because you're right. If you ask a question, how has COVID affected your life, or has COVID affected your life? Well, everyone's going to say yes. It doesn't tell us anything. It doesn't. We know there wasn't COVID before this, when this survey was circulated prior. So I think it's really this on the CBO side, the community-based organization side. I think that's going to be very telling to find out. Well, you know, we had to switch to all virtual, and we found out that we had greater participation in our programs. Well, that tells us something. That tells us that virtual, or a combination of virtual and in-person, is probably the way to go from here on in. So I'm getting responses saying that that makes sense. Are we kind of in agreement on that?
Yes, I'm in agreement with that.
Yeah. Yeah, I think that's the way to go. And believe it or not, that just popped into my head right now as I was sitting here looking at this.
A good idea.
Yeah, I think that if somebody certainly wants to write what are the biggest health concerns for your community and they write COVID, that's fine because we've always had a choice for other. And that would be quite telling that if more people wrote that down as, you know, they're supposed to pick three as their third choice, as one of the three choices, I think when we look at the results, that is going to be quite telling to us because if now we suddenly have COVID in the top three in 70% of the surveys, well, then we know it was an issue for everyone, for the majority in the past year and a half. So let's leave questions, the first question as is, and the second question is with the understanding on the second question, just one thing we have to go back to, should we in vaccine preventable put an IE, not COVID though, put like measles, chickenpox, or flu? Or just leave it vaccine preventable diseases? I'm gonna go out on a limb and say that the population that might not have known what vaccine preventable diseases means after having gone through COVID and the vaccine push, I would say there's probably a good understanding now of that terminology, even those who might have a low health literacy level.
I agree with that too.
What's the feeling about that?
I think we should have probably defined it originally, but since we didn't, I don't know that we should now.
Right. I agree. I think we can leave it as is. That's my feeling. Anybody not agree with that? Please voice your opinion. We want to make this a document that everybody agrees on. That just popped into my head now too, that they probably have had they've been deluged with messages about vaccine and this should it be vaccine preventable with a hyphen? I don't know, maybe. That's the grammarians, maybe it should be. Maybe, probably. I don't know if the prevention agenda has a hyphen. If they don't have a hyphen, we don't have a hyphen. So anyway, that just popped into mind. There's been so much education and discussion about vaccines and that they prevent COVID or they prevent serious illness from COVID and hospitalization and death, that I think a good percentage of the population has to understand what vaccine preventable disease means at this point. Okay, so we'll leave those questions. Well, that's good. If we look at question 3, we were concerned, and this is the one about insurance. No insurance is always, no insurance always, we always have a high percentage that say that that's one of the reasons that, what's the question asked, question 3, what prevents your people in your community from getting medical treatment? And no insurance most often rises to the top, which has been very baffling to us because we do have a 95% insurance coverage rate throughout the state, and probably, I don't know exactly what it is on Long Island, but I think it's pretty close to that as well. So the suggestion was, well, maybe not say, we should change it to what prevents you, because maybe people are interpreting or surmising that others in their community don't have insurance when that's not quite the case. And maybe we should be asking, is that what causes you, Mrs. Smith, to not access health care? So that was the question we posed to ourselves there. Another suggestion was prevents you and your family, again, making it more about the individual and not the community perception. And we also talked about not changing it at all, just don't change it or don't change a question that's already there. So what are we doing? So if we change this question, what prevents people in your community from getting medical treatment? Please check up to 3. We don't ask what prevents you from getting medical treatment in any question, do we? Ongoing health concerns for yourself. What about that? What if that question were changed and it read, what prevents you and your family from getting medical treatment? Yes, Brace says, I have no idea why people in my community are not getting medical attention. Wait, what did you say? Wait, that chat went away. Let me read it again. I'm getting confused. I only know about people close to me. Okay.
Considering the
So-
fact that the survey is ongoing, I think it would make sense to add another question. What prevents you from, or your family from getting medical treatment? But I do think it's important, even just to show the, conception that maybe there isn't a lot of insurance coverage when there actually is. I don't know. I would think it would make sense to keep the question as is and add another.
I agree with Brooke, again, for the same reason that we have been using the same survey. I'm trying to remember why, but there was a reason that we originally asked about the community, because it was trying to capture a perception. But I do think that it would be valuable to add a question, or maybe even have like a 3B asking about you and your family. But removing it altogether or changing it, again, will change sort of the historical information we have.
Yeah, you know what? I think, Selena, the reason why, and this is just another gut response, we had it as community. Perhaps we felt that if we said you or your family, we would not get, people would shy away from admitting they didn't have insurance and wouldn't truthfully answer the question.
That's
Maybe not.
possible. I don't honestly remember.
I don't remember.
Exactly. But I do think we could add you and your family.
As another question.
Yes.
What are the other thoughts among the group?
I think it might get confusing. You're going to have almost like a duplicate question. Only one is going to be concerning other people. And unless you're talking about the leaders of the community, I don't know what Mrs. Jones will feel the reason their whole community is not getting
Yeah,
the health care.
that's a good point too.
Yes.
I had suggested, because I think sometimes when people read that and they see no insurance as the option, again, this is just based on my own observations and feelings, that what they might be confusing no insurance with is inadequate insurance. So for instance, they may have a high deductible plan. They technically have insurance, but when they go to access care and use their insurance, they suddenly find out that they have to spend $3,000 before any kind of insurance kicks in. So maybe adding another option, adequate insurance, or what is the question? How does the question read?
Or it could say no insurance or inadequate insurance. Like it could be one choice. You could add inadequate to the no.
Add inadequate to the no.
No or
No
inadequate.
or inadequate insurance.
No insurance / inadequate insurance? Is
Yes.
that your suggestion?
Yes.
I'm looking at a chat. I'm just going to jump back for a minute regarding the question about the community response, the you and your family question. I would ask the question about you and your family. You can compare this response to the community response. I think there's more value in the you, your family question. It may also be good to clarify in the responses, no insurance versus poor insurance coverage, which is what we're saying, no insurance, inadequate insurance.
But I
Poor
think
insurance
Jen is
coverage
saying
as
it
poor
should be
insurance
separate.
Jen is suggesting poor insurance coverage as separate response from no insurance.
I have a question. This is Andrea. I'm
Yeah,
just looking at the first paragraph of the survey and looking at who this is going to. This is going to only organizations and agencies?
no, this is the individual one.
Oh, this is the
This is
individual. Okay, all right. So this is not that one. Okay, just want to make sure. All right.
Yeah, no, we're gonna get to that one
Okay.
today.
All right, never mind. Okay.
Okay, so, all right, so we had a little bit of, discussion going back and forth here. Jen, is that you from Stony Brook? I'm not sure if that's Jen.
She said yes in the chat. She might
She
not
is
have a
from
mic,
Stony Brook,
maybe.
okay. And Jen is in planning at Stony Brook, so I'm sure you're looking at this from a much more informed perspective than I am. You feel there should be two questions? Or you feel there should be two separate choices? It should be no insurance and then poor insurance, or I think inadequate insurance. The other half of the group says one response, no insurance / inadequate insurance. Jen, do you want to come off mute and talk a little bit, your thoughts through a little bit, so that I can everyone can understand it a little bit better than just from the chat?
Can you guys hear me?
Yes. Hi,
Okay.
Jen.
Hi, everybody. Well, so from my perspective, no insurance versus inadequate insurance coverage are two separate things,
Mhm.
two separate problems. So I would advocate, therefore, to make them two separate responses and not group them together. I think, as other members of the group have said, maybe we don't want to mess with the integrity of the survey and change an existing question, where we're asking about the community. But I believe that we might get a stronger or more actionable response asking about one's own experience. Our perceptions of the community are shaped by many different things and may not be particularly accurate. I would be curious to see if there's any difference between what folks say about the community versus their own family experience, if there's a difference. But I think it's valuable to understand what people's personal experiences are.
Okay. So which question? It's so tiny, I'm having trouble seeing it on the screen here. What are your biggest ongoing, where's the insurance? Number 3, right? What prevents people in your community from getting medical treatment? Jen, you're saying it's important to know both what people perceive is the problem for their community and what they know is the problem for themselves. Is that the distinction you're asking to be made?
Yes, although I think understanding, what we're each best at describing is our own personal experience, right?
Mhm.
But I understand, why we were asking the question previously. And I think I would leave it there, but ask, personally, what's your experience? And I'm curious to see if there's going to be a difference in how people respond. But, given the fact that folks have noted, we're seeing no insurance as being, usually receiving many responses, yet, we don't seem to have, a lack of insurance coverage so pervasive. I think we need to tease apart the question about, insurance, no insurance versus inadequate. And I think I would check the perception versus the, maybe the reality of what people's individual experiences are.
Hi, this is Andrea. I agree with that. I think it's important to distinguish between those who do not have insurance versus those who have inadequate insurance or who are underinsured. And going back to my point before, I was making sure I was reading the right survey, but thank you for putting up the survey we were looking at. In the beginning, we do say the issues that are important in your community. So it does lead to then us asking both types of questions. What are your concerns for yourself? And what are your concerns for your community? So with that said, I would advocate whenever we can ask for people's perception about what's happening in their community. I would encourage those types of questions in addition to asking about what are your concerns for yourself.
There's a note in the chat. Linda Mermelstein says the option for insurance is sort of addressed by the option unable to pay copays / deductibles. And that's usually the number 2 reason that pops up.
Maybe we could add inadequate insurance to that option of unable to pay.
Well, what this is leading me to think is if no insurance and then that unable to pay copays deductible, that pops up as number 2. Sometimes that's number 1 and no insurance is number 2. It seems to me that individuals are already understanding that there is a bit of a difference between having no insurance and having bad insurance. It's just maybe the way this was written not many years ago, but when this was initially written, the high deductible plans were not as popular. But we do say deductibles, unable to pay copays deductibles.
I mean, I think that, you know, when you say someone's underinsured, it's either that the insurance doesn't cover whatever their medical condition is, or that there's too many, you know, the copay is more than they could afford, or the deductibles.
It's more than they can afford.
I think those are the only other choices. So you could say the insurance coverage stinks. I don't know. Like, or, you know, sometimes what happens is you have insurance coverage, but then you get stuck with a bill because they say, well, it was pre-existing, or, you know, it really wasn't an emergency and you went to an emergency room, or, you know, for whatever reason, they might stick you with a bill. Or there's also surprise bills too. So.
Yeah, well,
I mean, you also have others, so there's an opportunity for people to write in whatever's going on too. So.
Yeah.
I agree that other spot is where anything else could go to further explain.
Yeah, but I don't know, I would put a vote in for adding another question about you personally and making it just 2 separate questions.
Maybe we could take a vote on that now. You know, who is in agreement with adding that other question for yourself and your family?
Can I just ask, there's on the next page, don't we ask about insurance? If the person is insured, the one filling out the...
We do. We ask what kind of insurance they have.
Do you currently have health insurance? Yes,
Yes.
no. No, but I did in the past.
Oh, okay.
And if they have Medicaid, Medicare, or private commercial, or no insurance again.
That would be interesting to compare.
You could put the question there and say, you know, does your insurance, can you afford your health care given what you have? Like, does it suck?
Keep in mind as well, we have to keep this to 2 pages. So we can't.
I wonder, have we compared those 2 questions? The do you currently have insurance to the survey responses where individuals said that no insurance is a big problem in their community?
No, because that's not been part of the analysis as it's set up and that we pay for. It would have to be a separate analysis. I don't know that it's going to provide us much insight, because a lot of times people don't even fill out that last question.
And the reason that we need this more refined is for what? What is this? What is the?
Well, because the reason why this came up is because in question 3, the option of no insurance, having no insurance, historically has been rising to the top, but we know that in New York State, we've got about a 95% insurance coverage. So there's a very small percent of the population without insurance. So we thought the question, well, I don't think the individuals answering the question understand their insurance, which has always been an issue. They don't understand that they have a high deductible or they have co-pays they can't afford. They're just saying no insurance when indeed they probably have insurance. I don't know. It just doesn't gel with the insurance coverage that we know to be the case when we look at I think the American Community Survey gives a percentage of insurance coverage. We'd have to look at it real closely if we wanted to, I guess, go by small insurance area by small insurance area, which is another analysis that would have to be done. But I know overall it's like a 95% coverage rate. And so I don't know what to do about this question because in our notes, we have no insurance is always up there. It seems like a perception of others since New York State actually doesn't have a high rate of uninsured. And that's why we were thinking of changing the question to what prevents you from not accessing health care rather than saying what prevents the community from accessing health care. And at the top, the purpose of the survey is to get your opinion about health issues that are important in your community together, blah, 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 blah.
Janine, do we have the space to add the question about you, or will that take us on to another page?
That will take us to another page.
I wonder if there's a way that we could fit it into 2 pages, but I do think there'd be value in having that other question.
Not to jump ahead, but we did talk about removing the smartphone question because it's kind of outdated. You know, when we started this, didn't we have a question about whether or not you have a smartphone?
Yeah, but
So,
my
at the
notes
last
say
meeting-
not to remove this. We said, but don't remove the smartphone question.
Oh,
And
We wanted to
possibly
ask
add,
a question about broadband access, and we're going to talk about that in a little bit as
okay.
well. We were going to add a question there. So going back to 3, what prevents people in your community from getting, can we say what prevents you and others in your community from getting medical treatment? Can we combine that? Can we make it you and others? Because you are part of the community, you yourself. You are a
that's what
community.
Tish said in the chat, that you and your
Oh, did
family
she?
does represent the community.
I think we should keep it separate. What may prevent me, for example, I may be doing well in my community, so that I may have little barriers to getting what I need, but I may be aware about others having difficult time. So I do think we should keep it separate.
I do agree with that.
Mhm.
Yeah.
Well, I don't know how we're gonna do this and fit this, unless we make it like 4-point type. I don't know how we're gonna do this. Because if this survey goes over 2 pages, it sounds silly, but
No,
most
it
of the
doesn't.
most of the surveys are still paper-based that come to us. And it's long as it is. So if it goes beyond just a 1 page, you know, front and back, I don't know. I think we got to keep it as clean and simple as we possibly can.
I think if the consensus is to add another question, we can certainly try our best to keep it on the 2 pages, but I hear what you're saying.
Yeah, but what about if we take the options out where we have unable to pay co-pays and no insurance. What if we take, well, that's social determinant of health, right? Access and ability to, economics. All right, but what if we took them out? And then in that last question at the end, we say, do you currently have health insurance? Yes or no? Then if so, is it affordable or is it adequate?
I think is it adequate is better than affordable, because that affordable means like, can you pay
Yeah.
the price of insurance?
Is it
That's not your-
adequate? But now we're separating that from a reason why somebody might not go to the doctor as a barrier. What if we don't, what if we don't ask it as from a community perspective and we just ask about you and your family? Because it's true, that does represent the community, as Tish says. So go back up to 3. If we said, what prevents you and your family from getting medical treatment? Now, Dr. Altbrut has said she would be okay, right, if she were answering this survey because she has coverage and that's good for her. But now that allows another person who also makes up a member of the community to be able to honestly say, I don't have great insurance, I have inadequate insurance. And that's why I don't access coverage as often as I should, access care as often as I should. Would that do it? Don't use the word community?
I think we lose the opportunity to compare those responses if we eliminate that historical question personally.
Well, it's not that we would eliminate it, we would change the question and then we would
Right,
have
the wording.
Yeah, the wording, and we would note from here on forward that as of such and such an analysis that the question number 3 was changed from your community to you and your family.
Can I make a suggestion? Could we leave the question as it is, and then after fear, like on the right side, say, does this apply to you as well? Or you and your family as well, a yes or no? So whatever they answer for the community, then they could sort of say, oh yeah, by the way, that I relate to that. Might that work?
In other words, put next to that, do these responses apply to you and your family as well? Yes
As
or
well.
no?
That way you don't have to like rewrite the whole question and take up 4 lines of space, but you
Yeah.
still kind of get a sense of it. Well, is it just what they think about the community, or does that them too?
What about that? So that seems like a good solution.
I mean, I think that could work. It's just, then if they say no, then we don't know, but we have to accept some limitations because we can't ask everything. So,
Right.
I think that's a reasonable, solution, because
Yeah, or you could put,
otherwise we're adding an entire question and that will create a different issue. So no matter what we do, there's going to be an issue. We just have to decide what we're okay with.
yeah, I mean, if you could spare 2 lines, you could say, does this apply to you and your family, and then explain if you want to put another line, and then they could write in whatever the issue is.
I think because we're so confused as to why the answer is what it is in that question, it just requires some further exploration. I wonder if we should have a prompt, see if people want to explain what they mean, where it might be tough to add that in too, but I don't know, maybe this question just is, maybe we have to look at other surveys and see what they're saying, see if it matches. Is this question to see if the answers are like wrong, or if there is something that we're missing, whether it's with a large population of undocumented people that are answering the survey, or they have this perception that a lot of people still don't have insurance, even though our rates say something different.
This question appears to be teasing out what social determinants of health are the issue, right? So it's transportation, it's language, it's cultural, religious beliefs, etc.
I mean, again, you probably maybe could say, again, after fear, you could say what prevents you from, or what of the above prevents you and your family. You know what I mean? So you're asking them to just write in which they've marked that apply to them. You've already, I mean, I think the idea of using multiple choice is to give them ideas to think about and to sort of standardize a little bit. You could count it up. You've kind of already done that. So if you ask them the same question within the question, you'll get, you know, you've already walked them down the garden path to know, well, these are the things we're thinking about. Just a suggestion.
I like your initial idea, Linda, of just saying, do these responses also apply to you and your family? Yes or no? Because now, well, but then
If the answer is no, I'd be curious to know what.
So your other choice, Linda, is you're saying to have individuals, please tell us that of the choices above, what three prevent you and your family from accessing treatment?
To ask that question, but not with so many words, because you don't have that much space.
Right. So then they get a line and they'd write the three in. Some people would write one, some people would write two, some people would write none, some would write five, you know.
That will just become an issue in the analysis. You know, that's why we were trying to avoid these like open-ended. Because in a perfect world, people would follow directions and pick three, but then they could put in anything. And what do we do with those? You know, if they put in some other option.
That's true too.
We could accept that we're changing the survey and change the question. I mean, that's not terrible. You can't compare it historically, but I don't know. Are we really doing that? I mean, are we saying that responses changed over time? Have we, we haven't really done that. If we're looking.
We do look, we do compare historically what's happening over time to see if there's a trend.
Okay.
And over time, no insurance, I don't have the data right in front of me, but I know that's been up in the top three pretty much consistently since we've been doing this.
So it could be a justification because we know that that question is an issue that we change it. You know, I mean, I don't know how other people feel about it, but if the question is a problem, then maybe we do need to change it.
I'm just thinking out loud. Is it possible that maybe, you know, lack of insurance is affecting the individuals taking the survey more so than the rest of Long Island's population, since we are targeting higher need communities? I'm wondering if that could be contributing to that answer. Just thinking out loud.
The responses are interesting though, even though like in Suffolk County, number 1 and number 2 were unable to pay co-pays and deductibles and no insurance. In Nassau County, it was actually no insurance was number 1 and fear was number 2.
Right. That's for this last analysis, but a previous analysis, it was probably at some point no insurance.
Yeah.
It doesn't always pop up there, but
Janine, this is
yeah.
Tish. I just to bring something to light, back in the last cycle, our hospitals in Catholic Health did a drill down and I just pulled up one example. So on number 3, 48% of the people from one of our hospitals, 48% of the people who took the survey said No insurance, that was the first, what prevents people from getting medical treatment. No insurance, unable to pay co-pays, deductibles were the top two. Yet for the people that took that survey, 90% had insurance, which is why I think a lot of it is perception. People think that others don't have insurance, and that's the reason. But I think it's important to know if it's your own perception or it's your own experience. And that's why I thought you and your family, you do represent the community. And so then you're answering it, you get a more realistic picture of why they're not getting treatment. Not, I'm insured, but that would be my assumption that people don't have insurance, but I could be wrong.
After hearing it explained that way, I do think it makes sense to kind of have you and your family replace
community.
Yeah.
I do. Or just add that caveat that, does this apply to you and your family? So then you get perception and reality in one question.
I do believe that is why we are getting that high answer about no insurance rises to the top, because I think people are looking at it as what's happening in their community, and they're not reflecting on themselves. And I think that explains it, because 90% of those who said, 48% said they didn't have insurance, they didn't get care because they didn't have insurance. But when you looked, 90% did have insurance. So which means they're not looking at themselves, they're looking at that question and what is happening to others. So I think we can go one of two ways. We can change the question to what prevents you and your family from getting medical treatment, or leave the question as is, and then after fear add, do these reasons also apply to you and your family, yes or no? I think those are our two options. What's the group think about that?
I would vote for changing it to you and your family, as that is representative of the community. Carolyn just put in the chat, why is the perception of the community more important than reality? I think that's a good point. And Grace had said she agrees. I will answer differently for my community than I will for my family. I think we would definitely get a different picture from that question for sure.
And as Selena said, I think we have justification for changing the question, because we realize that it's not when we look at what the real coverage rates are, insurance coverage rates, it doesn't gel, as we saw in the example that Tish just presented to us. It doesn't gel with what we know to be true.
One of the caveats, one of the things
really helping us in any way. It's giving us false information.
One of the things I'm wondering about, I think maybe we have to change the question and just see what happens, to say you and your family. But one of the other things I think maybe in a later iteration we can think about is insurance doesn't cover everything, we know that much, right? And if the second after that question, what is needed most to improve the health of your community, and they say mental health services, there's not a lot of insurance coverage or adequate coverage for mental health services. So, or, dental and things like that. So I wonder if that's something that we're not thinking about. We're just looking for medical insurance coverage, and the state reports is also just for medical insurance coverage. I know we have the inadequate thing, but I just wanted to throw that out there. But I think I agree with changing the question to you and your family. I think we're at that point where we're just confused with the answers.
I do have a question, and I apologize. This is more of a background question for me because I'm new to the group. Can you, and you may have said this already, can you remind me how do you go about sending out this survey to the community? Because the reason I'm asking is because I think Tish was saying those who completed the survey I'm guessing they were part of the hospital system. And so these are people who more than likely, and correct me if I'm wrong, if they are part of the hospital system, they're more than likely obviously getting care and therefore also more than likely have insurance. And so I'm worrying about selection bias overall, because if we are targeting the survey to people who are more likely to utilize the system, they're going to, and if they're talking about their own perception, we're going to have results that are skewed towards towards that population having good access to care.
That's
So-
always, that, it's a good point. That's something we've always been concerned about. And I'll just quickly run you through how this survey is disseminated. So it is up to, or rely upon all of the partners of the collaborative, the hospitals, the health departments, to distribute the survey at any kind of programs, health fairs, events that they're holding, to distribute the link to the survey in any kind of electronic communication, community newsletters. We push it out through social media. We've provided you with social media, a social media toolkit to send posts out and get people to click on it and take the survey. It goes back to my saying that data output is only good as the data input. And if there's not organizations and because, you know, we don't run programs here at the Long Island Health Collaborative. I mean, ideally we would have people stationed at supermarkets and outside libraries and salons and other gathering places and getting people to complete the survey, but we don't have the manpower to do that. So we rely upon our list and our collaborative members to push that survey out. Some collaborative members push it out more than others, and that you get back what you get back. I know that Winthrop would like to see a much greater response from the Hempstead area, as we all would. But short of, again, going to a community event in Hempstead, as perhaps establishing a relationship with the mayor of Hempstead and asking to be able to go door to door and hand out these surveys, I don't know what else to do.
Yeah.
We are right now boosting posts in the high need areas that we've identified, the select communities that were identified in both counties. And we are spending money, the Nassau Suffolk Hospital Council is spending money boosting those posts so that we can get individuals in zip codes, Hempstead, Freeport, Riverhead, whatever all those communities, whatever they are, so that we get a good representation. But it's not like we have the resources of a research firm to go out and
randomly select from the
Yeah.
community. Yeah,
Right.
got
I
it.
mean, we can't, if we had a phone bank, we would randomly make phone calls and do the random selection. And so, our hands are a little bit tied on this, and it's always been this way. We did do an integrity analysis of the results the last time we did the CHNA back in 2019 against the population, like were the responses representative of the population. And when we did that analysis, and I can send that to everyone, pretty much the responses did mirror what our population on Long Island looked like, except in a couple of areas. Like we didn't feel there were enough young males that responded, and a couple of other issues. And I can send that to everyone. But so we've looked at that issue.
We have a lot of people sharing in the chat how they distribute the survey, so thank you for that. And I did just want to add that we did create a toolkit for anyone and everyone to use to send out the survey on social media. I put that in the chat. And if you're open to having your logo put on there and co-branded with the collaborative, we can certainly do that for you, turn it around in a day or two and get you those graphics. So I just wanted to remind everyone of that.
So I don't know if that answers your question,
It
Andrea.
does. It does, yeah. And this helps me think about, if it's important, how important it is for us to get to know what individual people think about their issues with accessing services versus the community.
Yeah.
Yeah.
And we're going to cover the community. Well, when we speak to community-based and do the community-based organization survey that goes out to community-based leaders, that's going to be another perspective that we have.
Mhm.
And then, of course, all those secondary databases that exist out there, the eBirthis, and well, we can't look at Sparks data because I don't have access to that anymore. But all those secondary data sets that are out there, you look at that as well. A lot of what the CDC has. So that'll supplement this. This is not like the be all and end all. This is like not the only tool that you use to determine what priorities the group should focus on moving forward.
Got it. Thank you.
Okay. So for, what did we decide for question 3? We're going to change it to you and your family and take out community. Right? Yes?
Yes.
Yes. Okay. And then that brings us to, on question 3, we discussed immigration status. What was there a concern about that? Question 3 option.
One fix for that, because the question was whether or not we should conclude it, because Tabor, I think's concern was, it may scare off some people. One fix for that, under FAIR, you have examples not ready to face, discuss health problem. FAIR to also, capture people's fear about revealing their immigration status. So you could list it as an example there.
Oh,
if you want.
Okay. That makes sense.
I think that's a great idea.
That is a good idea.
Thank you.
Okay. I knew this was going to take us a while.
I'm sorry, is that question 3 still?
Yeah.
Fear is on there.
She's saying to add immigration status as an example of fear.
Oh, gotcha. Okay, sorry about that.
Okay. Then going down to the end of the survey, the only other discussion we had previously had was the question about
Zip code?
no, the zip code, that's not a
squashed that,
question. We
right?
explained why that was the way it was.
The internet access.
Internet access. So if you could pull it down a little.
I'm just going to go to our next slide.
Yeah. Yeah, we did a little research to see what the broadband access is, if we truly have an issue here on Long Island, and we really don't. If you look on that chart, we're like what is the percentage of population without broadband is like 2%, which means like 98%. There's almost 98% coverage of broadband on Long Island, and where we don't have a percentage of those living in an area classified as rural, half of the 2% are in a rural area, which really is way out east. And they don't come up as our high need areas to begin with. Well, I don't know that we need to put this question in. What does everyone think about that?
Can you go back to the survey?
Sure. Might take me a moment. Oh, sorry, that's the.
We had all got new computers a week or so ago, and things are still popping up on different screens. We're still trying to figure out, they're just still acting a little strange on us, but there you go. So the question was, we don't have the question there about broadband. We have a
Right.
question about, do you have a smartphone, yes or no? And my notes say here that we should not remove that question, but maybe we should add one about broadband access or internet access in your home.
Right, because we had said they might have tablets instead of smartphones or other devices.
Okay.
Why do we, so I recall that we had put that question on originally, but that was kind of, you know, early on in smartphones. I mean, it was quite a while ago. Why
Right.
do we still need that question? I'm just asking the group. You know, what are we doing with this question? What are people using it for?
Janine, weren't we using that to find out if we can disseminate information via the internet, if they had access to a smartphone or if they had it for a tablet?
But that was the original reason, but I'm saying now, I feel like everybody pretty much has internet
don't-
access somewhere.
I think one of the reasons as well was that we discovered, particularly in those higher need areas, that they might not have had internet access or had cable, but everybody had a smartphone. And that was one of the, I don't know even why we were asking that, but that I recall. You remember, Selena, we found that to be a finding and we said, oh, that's interesting. So maybe we should learn more about this.
Yeah,
And
but
I think that's,
I feel like it's outdated. I mean,
Yeah.
that's my personal opinion, that it's an outdated question that we don't really need.
well, I'm happy. I agree. I don't think we need it any longer. That's for the group to decide. What are some other feelings about this?
I think we can get rid of it.
Yeah, I think probably the more important question is, do you not have access to the internet? Because that's more the unusual. So if you find people out there who don't have access, that would be more telling.
Maybe we could replace the smartphone question with an access to internet question.
We could ask, do you have reliable internet? Do you have access to reliable internet?
In your home. Because they could have internet at their jobs, but not at their home.
In your home.
Yeah, I think in your home makes sense.
We good with that?
Sounds good to me.
Okay. There were no other discussion items that we had for the survey.
Okay.
So we're gonna make those changes. This is gonna be the individual survey, community health assessment survey moving forward. We'll send it to everyone. We'll make changes on SurveyMonkey. And on our site, it'll be changed. Hard copies will be changed.
Okay.
Okay. All right.
Moving on.
So the next is CBO survey, and I know we're getting tired. We're an hour and a half, an hour and 20 minutes into this thing. The CBO survey, as I said, pretty much mirrors the individual survey. We'll just pull it up in a second. Hold on. There's the CBO survey.
You all see that? Can you see it, Janine?
I can see it.
We
Okay.
can see it.
Okay, and this health survey is for organizations and agencies. Quick background on this. This CBO survey, and again, this survey and the individual survey were developed as a group back in 2013 with county officials, with individuals from community-based organizations, with members from hospitals, and the questions were designed to elicit both individual and community responses. There were epidemiologists working on this so that we weren't just willy-nilly asking questions because we thought they were great questions to ask. I just want to remind everyone that it was a very deliberative process. Took many months for us to finally come to consensus on our questions and on our survey. The community-based organization survey. Oh God, my daughter's texted me. Kids. Was distributed in 2013. At that time, it was distributed by the counties, the hospitals, and to some organizations that I knew of, but it was a small list because we were just getting going. Since then, the collaborative list has grown to about 300 organizations, including the hospitals and the counties and whatnot. So there's a much larger list. We did not send the survey in 2016. We had a community-based organization summit, roundtables, one in a summit in Nassau, a summit in Suffolk. In 2019, we did kind of community-based organization focus groups along with individual focus groups. And then this would be, we decided that we would send the survey now for the 2022 community health needs assessment. One, because I have no funding anymore and no staff except Brooke. And we haven't done this in a while. So we thought, it would be a way that we could at least solicit the community's input. We would send to our entire list of 300 or so. And we would ask you, and we provided a link to look at the members of the collaborative. If you see an organization that is not listed on there that you work with, send that contact information to us and we will add that so that we hit as many community-based organizations. Public health professionals, they don't have to be part of an organization. It could be, a public health professor. It could be somebody who's an epidemiology professor working on a particular project. Any individual that you feel would have good information to provide to us, we'll send it out to them. And we will provide you with a standardized block of copy for an email that you could send it to your contacts to let them know this is coming, what it's about, blah, blah, blah. Okay, so that's the background of the community-based organization survey. As you can see, if we go through it, it's asking pretty much the same questions. What are the biggest health problems for the people, community you serve? Please check up to, how many? 5? 5, right. And I'm going to have to build an analysis model for this because the way we did it prior was just through SurveyMonkey and just kind of downloading the Excel file, and that was our report. I'm going to have an actual analysis model built, so there'll be some expense that we incur in doing this. And then so you can see it if you want to take a look at that. We can go quickly through it right now. The timeline says that by next meeting, we will make a definitive decision on our community-based organization survey questions. So let's just take a quick look at them now. If we go back to 1, we've got quite a bit of choices there. Access to vaccinations. I find that funny that that's the first choice. Oh, I see they're in alphabetical order, are they? No, they're not. Oh yeah, they are. HIV.
But then violence has some sub options.
Yeah. So it's a little more extensive, right? So they're choosing 5. Asthma, lung disease, cancer. They've got disease-specific categories: child health, wellness, memory loss, diabetes, drugs, alcohol abuse, environmental pollution, falls, heart disease, HIV and sexually transmitted diseases. That's interesting. Infections, preventable injuries, mental health, nutrition, obesity. I mean, this covers a lot. Smoking, teen pregnancy, violence, women, health, and other. It's a lot to digest right now, but so what I'm going to say is we're going to go through it. I just want you to really take a good look at it. In the interest of time, it's 2:30. And seeing as we're probably all getting tired and I don't have any more musical renditions to offer to keep everybody awake, unless you want me to sing again, which I don't think you do. We won't tease out the specifics of each of this right now, because I think it would take too long. All right, question 2 is, what would be most helpful to improve the health problems of the people, community you serve? And again, a check 5 again. Access to food, affordable housing, better schools, breastfeeding, clean air and water, drug and alcohol services, more grocery stores, farmers markets, health education programs, health screenings, home care options, insurance enrollment programs, job opportunities, mental health services, parks and recreation, safer childcare, safer places to walk and play, safer workplaces, transportation, weight loss. These are very extensive. And what is the third one? Do any people, communities you serve have problems getting needed health care? We say, if yes, please answer question 4. Now, do we ask about unable to pay, co-pays and deductibles? Do we ask about insurance? No insurance and unable to pay for the care. Transportation, language barriers, lack of availability. So these mirror again what was on the other survey. Number 5, what types of health screenings and or services are needed to keep people healthy in the community you provide care to? I'm going to check 5 again. Again, very extensive, disease specific. We've got vaccination, immunization on there. Okay, let's go to number 6. What health issues do people in the community you provide care need education about? Ooh, that's kind of worded oddly. Okay. Again, specifics, blood pressure, smoking, suicide prevention, prenatal care, nutrition, drug and alcohol, routine well checkups, exercise and physical activity. And where do the people, community you provide care to get most of their health information? This always usually is the doctor followed by the internet. This is similar to a question that we ask in the individual survey. And what do you think makes a community healthy? Those are write-in questions. How would you rate the health of the people, community you provide? And if you, okay, and then we ask the question, if you're able to, would you, community person, be willing to engage in a more in-depth interview and key informant interview to learn more about the people in the community you serve? Now, depending upon the number of individuals that say, yes, I would, if it's a handful, we can handle it here. If it's like 20, then we're going to have to form some kind of a subcommittee, and figure out how we're going to do this. I do have the key informant tool that was used when we interviewed CBO representatives back in 2019, when we did those focus groups. So I do have that tool, which was developed by a research firm. So I know that the questions, there's integrity of the questions, there's good validity in the survey instrument. So we have that we can work from. And we would then have to put our heads together, depending again upon how many people want to be involved in a follow-up interview, which I would suggest to do via Zoom, and then we would record it, and then we would take those recordings. We would have to come up with some keywords, phrases, themes that we're looking for. Collaboratively, we would come up with that, and I could run it through qualitative analysis software that we have here, and then produce a report. So that's I kind of got ahead of myself, I think, on the slides, but that's the community-based organization survey as it stands right now. If you want to take some time, we do have a half hour to look at a couple of these questions and have a good discussion as to whether or not the choices are appropriate. Do we have too many choices, not enough choices? Because remember, this has not been done since 2013, so there really isn't any historical significance to it, but there is not, it's not something that we've been analyzing on an ongoing basis. It was done way back in 2013. There were only maybe 100 organizations involved, if that. I don't even know if it was that many. So I think we could probably start fresh. So if we want to take some time now just to look at a couple of questions, that probably would get us off to a good start. Somebody has said, should we add something about vaccine hesitancy here, which is probably something we should add, coming from a COVID era.
And a COVID question, perhaps, as we discussed.
What, is everyone okay with maybe taking a couple of questions and picking it apart right now?
I'm okay with that. I have a question though. It kind of depends on the CBO as to what the answers, like right now, if you asked me, and I'm in the cancer center, so my first response is going to be cancer, 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 because that's what we focus on. But if you ask the Stony Brook person who's on for the whole, you know, if you ask Jen, she's going to say, this is the general for the hospital. So I don't know, like you must have had some thought about who you picked for the CBOs to participate in this, I presume. General and less specific.
We do at this point, if you take a look at the collaborative list that we have in a link that we sent to you, we've got a pretty good cross representation of types of CBO organizations, those who work in transportation and mental health, those who are, you know, providers themselves, like the hospitals, like Stony Brook. And it's fine if more than just one individual at a particular organization responds. That's fine as well.
I just wanted to pull up where we have all of our members.
Yeah, of course, you are going to answer differently, Linda, than Jen would. And I would answer differently than Selena would answer, because Selena is coming from a different perspective than I'm coming from.
Yeah.
There could be organizations on there that should be on there that you are know of. That's why I'm telling you to let us know, and we will add it. I mean, in the end, I see this probably going to about 400 or so organizations. It's a much larger pool than we ever had before, so that's a good thing. But I think we got to settle on the survey itself first. And then our timeline, I think we're going to want to get this out by like mid-November-ish, kind of. Is that what we said? Yeah. And leave it out in circulation for about 2 months till like mid-January. And then, because we got to have time to interview those individuals who want to be interviewed. And depending upon how many say yes or no, we got to leave ourselves some time to do that, and then do the analysis and turn all this around by like the end of March. This analysis, the individual analysis, community health assessment survey analysis. So it's kind of a tight timeline.
So it might be good to think of just what's changed between 2013 and now. So I mean, we all know pandemic, but is there anything else major that happened in the health field, like people started getting vaccinations through the pharmacies instead of doctors' offices, things like that, and then pick out, identify those things, and then see if any of it applies to these questions. So otherwise, if you go question by question, you can come up with a million different ideas of things to answer.
Right. Well, what I'm saying is, let's see what we have there now, and is it sufficient? And yes, what has happened since 2013 to 2021 that might cause us to say, you know, we don't need that choice anymore, or we should add this choice, or we should make a subcategory of this particular choice. So the first question.
Sorry. Something also to keep in mind is these came from the prevention agenda priority choices. So if those are the same, I mean, we have to keep some of them for that reason, because we have to select our priorities based on the prevention agenda. And that's where these choices came from, most of them. And we could also add some, take some out, but we do need to maintain the prevention agenda priorities.
Yeah, and the priorities from 2013 to now have changed just slightly. There's still 5, there's still, the main ones still exist. They did rename some of the priorities. They did refine some of the focus areas, which, by the way, we can choose 1 priority and 2 focus areas, and that satisfies the requirement of 2 priorities, just to keep that in the back of your minds.
But we have to be cautious if we're removing things.
Right. So I think I shared last time with everyone, and we could pull it up here, but we don't have to do it right now, but the updated list of priorities with the focus areas. For instance, in priority area 1, chronic disease, physical activity and nutrition had been together. They teased those out as separate focus areas now. So just, they made some slight changes, but not drastic changes. I don't think that's it. Don't worry about it. We don't, we don't have to pull it up right now. I'll send it again to everyone. Since they did not drastically change the priority areas, I think we're safe to take a look at this right now. Biggest health problems for the people in your community: access to vaccinations. I think that's pretty appropriate right now. That's pretty darn good. Then we have the individual diseases: asthma, lung disease, cancer. We have caring for the elderly. I don't think that's changed. Child health and wellness, that hasn't changed. Memory loss. I don't know why we have that specifically identified, but it's there. Diabetes, drugs and alcohol, environment. We still have problems with water, pollution, and air. Falls in the elderly, which is still a problem. And the cross-cutting principle for the prevention agenda, or the way they've kind of modified the whole approach to this, is that this is a prevention agenda to ensure that we improve health for people of all ages. So they are kind of including an emphasis on aging well and healthy aging. So it's not inappropriate in this particular survey to have falls in the elderly included in there, and I guess memory loss. HIV, AIDS, and sexually transmitted diseases. Does that fall under, should that be under a category of just infections and then subcategorized? HIV, STDs, COVID, communicable, communicable diseases. Like, I don't know, HIV, AIDS back in 2013. We may be making progress.
Like a specific category in the prevention agenda at one point.
Yeah, I don't think it isn't. Let me see.
And I wonder if are infections the same as communicable diseases, or I don't really know exactly what that means.
Are the infections under like MRSA and stuff like that?
Oh, maybe.
Prevent communicable diseases is the name of the priority. That's priority number 5.
Yeah, and it has subcategories: Hep C virus,
It has
antibiotic resistance, sexually transmitted disease, HIV, and vaccine preventable disease.
It has, focus area 1 is vaccine preventable. Focus area 2 is HIV. Focus area 3 is STDs. Focus area 4 is Hep C. Focus area 5 is antibiotic resistance and healthcare associated infections. And then under each of those, there are specific goals as to what you want to achieve. For
I mean,
instance,
there's not a lot of room for it, but you could put under, you can make it communicable disease and then put those categories as choices. I mean, I would imagine COVID would go under vaccine preventable at this point. Or do you want to have that as separate because it's kind of a big thing right now? And, you know, with COVID, there's so many parts to it. There's getting the infection, there's, you know,
yeah,
getting the vaccine, there's getting monoclonal antibodies, there's
Right.
like,
there's treatment, there's
and
prevention,
then
there's
long
yeah,
COVID.
long COVID. Well, just getting back to what Selena said, the reason why HIV/AIDS was in there is because it was on the prevention agenda. And I think we do have to keep reminding ourselves that what we're trying to do here is find out what concerns, issues are on the top of the minds of the public while keeping, while holding true to what the prevention agenda wants us to investigate, right? So that because these are our choices. So
I wonder where COVID fits into the prevention agenda. Like, where does the state?
it's got to
It's
fit
COVID.
into
Is it-
prevent communicable diseases. It's got to be that fifth
Yes, yes.
priority.
Okay,
Because one goal under there is improve vaccination rates. And the second goal is reduce vaccination coverage disparities. That's all we've been doing for the past
yes.
practically, well, 8 months or so since the vaccine was released. Almost a year, be a year in December. Since the first vaccine. I don't know if we need to say COVID specifically here. Remember, these are the community-based organization representative members who are looking at this.
Possibly vaccine hesitancy.
I think vaccine hesitancy, well, wouldn't that be under access to vaccinations?
Oh, you're right. You're right.
Would you do access to vaccination and then a subcategory, vaccine hesitancy?
I mean, they are kind of two different things, so.
Yeah,
Yeah.
and it does seem everyone has access. It's just a matter of whether they
The
take advantage of
hesitancy,
that.
yeah.
And I think vaccine hesitancy is I mean, some people have vaccine hesitancy only for COVID vaccine,
Right.
you know?
Right.
So I don't know that they would
Good point.
necessarily say that it's general vaccine hesitancy. COVID vaccine hesitancy is its own little thing.
That's true.
We can ask it.
I mean, there are the flu vaccine and there are all the other ones that are out there right now.
I mean,
So there may be,
sorry,
go
go
ahead.
ahead. I was just gonna say that with the COVID vaccine, I have heard, I don't know if it's true or not, but because it makes you feel, you know, somebody might feel sick for a day or two afterwards, that they might have to miss work. And that's a reason why some people are hesitant to get it, because they can't take the time off first to go get the vaccine, and then they know they might be off work the next day or two.
But we passed the law in the state that requires employers to have to give you time off to get the vaccine. And then if you're ill, you're to get
You-
compensation. Because I know I did
didn't
this
know
for
that.
did this for my daughter when she had COVID. She worked for a salon and it went through their third-party insurer. I mean, she didn't get full pay, but she got something because it was less than X number of employees in the firm. I'd have to look at the regulation again. But a lot of people don't know that that exists.
I didn't know that existed either.
Yeah. Yeah.
so under the hesitancy, is there any hesitation for people to get the shingles vaccine, the pneumonia, the flu, or any of that? Or is it strictly the COVID?
There are people there, you know, we have healthcare workers who still refuse the flu vaccination. You know that, Carolyn, even
Yep.
though, you know,
Mhm.
and they have to
Sure.
wear the mask, right?
Right, there's an
Good
alternative
point,
of
right.
wearing a mask.
Right. That's how we got around the mandate for flu vaccination.
Flu
But
vaccine.
there are people who are afraid to get the shingles vaccine. I've heard of that. They think that it
Yep.
causes blindness.
So then the hesitancy might be one to add.
I was thinking it would be
Afraid
good
of,
in,
hepatitis, not hepatitis, the one
Maybe
that's
you should
girls
put anti-vaxxers.
and boys.
I was
Ashley?
thinking, yeah, I was thinking the vaccine hesitancy answer could go under 4. Actually, you might actually have something there that's kind of related to vaccines.
Under
'Cause it's-
4?
Under
Yeah.
4, you add brainwashing.
Because this is
Culturally,
where, yeah, cultural religious beliefs is one.
but we don't know that, you know, vaccine hesitancy can be related to that. But it also could not. Like, there's subcategories. This is the reason why people are vaccine hesitant. Mainly political right now.
Misinformation being there.
Misinformation.
That's a good way to put it.
I don't know.
That's actually a really good thing because you have people taking ivermectin and all kinds of other things. too
Oh,
that
God.
take
Yeah.
drinking.
So
bleach.
question 3 says, do any people, communities you serve have problems getting needed health care? So I would think most are going to say yes, but some will say no, and then that'll be the end of that. But for those who say yes, vaccine hesitancy added as a choice.
I like both of those and misinformation. I think those are 2 good ones.
And misinformation. Unable to
Does the
call.
hesitancy go under the fear checkbox?
Not everybody's fearful. They just, you know, some, right now, it's more of a political divide as to why people don't get, they do not, you know, it's a right. They feel that their rights are being infringed upon, and that's why they're not getting it.
You could put though fearful/hesitant to capture both.
Where is that now?
Well, under 3, and then after you answer yes, number 4,
Number
right?
4.
Yeah, fear.
It's the fourth choice down under
And
number
put
4.
fear and then put what?
/
Hesitancy.
Yeah.
Okay. No, oh, didn't we do that on the other survey? On the
So
other
the other
survey?
one, you put the immigration status as an example, and
Oh,
I was gonna
yes.
actually suggest you do the same here for this fair option as well.
Okay, so not ready to face health system, immigration concern,
Yeah.
comma, hesitancy?
Something like that. But your point about fair may not be, the political reason may be the reason why people are hesitant. So my suggestion was fair / hesitant.
But I still think you could add a box that says misinformation because some of the hesitancy is not really fear. It's more that people are just misinformed. They're listening to anti-vaxxers. They're, you
Mhm.
know,
I think misinformation would be a good option for number 1 as well, but I know we're talking about 4.
When you say misinformation, I'm assuming you're going to say vaccine misinformation or just misinformation about disease? Disease
Okay.
misinformation, what do we, because if we just write the word misinformation, I don't know if that's clear.
I mean, I think in number 1, it would probably apply to all of the diseases.
I think of number 1 as sort of like diagnoses almost.
Mhm.
which is why I thought that the vaccine hesitancy sort of topic can go sort of later on after question 3. And then the point that, I don't know if Dr. Rosenstein you made it or somebody else, about there's a lot of other things related to COVID that are now becoming problems, like the post-COVID syndrome, chronic fatigue, things like that. So I don't know about putting the vaccine question in the vaccine hesitancy question in number 1. It doesn't seem to fit in my head the way the survey is organized.
I think Linda made a really good point about the fact that the prevention agenda was posted prior to COVID. I mean, where does that leave us? Are we responsible for adding, questions that gauge people's opinions on COVID, or not so much?
State said yesterday they're going to add things about COVID, I think.
That they are going to for this prevention agenda?
Yeah, but under
topic
5. No, that's okay. It was just yesterday. If I heard them correctly, I think they said that COVID should be included in our activities.
Yes, but they're not changing prevention agenda priorities or anything that was agreed upon for this cycle.
Right. But COVID is inherently part of topic 5. So
It would be part of the intervention.
Number 1 are the
Will
prevention
also
agenda
be
priorities. So I mean, I do think that question number 1, we have to maintain the priorities, because that's what we have to pick from. I mean, we could add COVID because it does fall under a priority, but we are stuck picking from their priorities.
Yes.
So isn't community disease a priority? So that would include flu? I mean, if we have a bad flu season, and they've been talking about there being a bad, flu outbreak at some point. So
Yeah, that would fall under focus area 1, priority 5, improve prevent vaccine preventable diseases, improve vaccination rates. Any one of the organizations, hospitals, counties could decide, yeah, we're going to really push to get the flu vaccine out there this year, or not.
Yeah, and I think flu falls under infections. I mean, frankly, COVID does too, but I still think that it's so out there right now and it seems to be important. So if you wanted to quantify that, but otherwise.
Well, that is under prevent communicable diseases, which is infectious diseases.
Yeah.
Oh, I'm sorry.
So
there's no right or wrong answer here. It's
no.
Either way.
I understand, misinformation, but I also understand that misinformation can be misleading as a choice almost, because that sort of is a leading answer, because when you say misinformation, we know you're referring to COVID pretty much now, right? But when we say misinformation, are people misinformed in general about if they have some other health issue? Are they going to Dr. Zorro on the internet and getting self-diagnosing and getting misinformation and therefore not accessing the proper health care? Yeah, that's happening.
I mean, it could relate to teen pregnancy. It could relate to a couple of other things.
Mm-hmm.
But if we add misinformation to question number 1, it could apply to so many things. How are we pinpointing a priority with misinformation?
No. I was thinking under number 4 as one of the barriers to healthcare.
Okay, yeah.
That misinformation would be a barrier to getting the right care.
Could it be something just related to education, like?
Yeah.
Instead of using the buzzword, I think.
Yes, I think that's what it is. The buzzword is causing me to think that people will automatically go to COVID in their brain.
Yeah.
Well, I mean, just think that realistically, like as far as vaccines, anti-vaxxers are putting out misinformation, and that's causing an impact for all vaccines. But right now,
you're right. So misinformation. So it's really
lack of
education.
It's not evidence-based information, but you can't start using words like that. it's not, yeah, I mean, it's, misinformation slash,
Lack
Lack
of
of health literacy.
Because then you could say also it's part of cultural beliefs, you know.
you could,
Mm.
could. So misinformation, what did you say, Selena? Lack of health literacy?
I said health education, but health, yeah, health literacy would work.
So misinformation slash lack of health literacy? How about that, Linda? That kind of covers. I think that would work.
I'm good with any of these. I think there's a lot of good options.
Language barrier, yeah, because we don't say that, we just say language barriers, but we don't say health literacy, right? So there's a difference, right? Language barriers is
Yes.
you can't understand the language, but health literacy is you don't really understand the disease or the science as
Right.
to why
You
you have the
also have,
problem.
you have don't understand need to see a doctor.
Mm.
If you don't understand the need to see a doctor, that is health literacy.
That is true. Should we eliminate that and put misinformation slash health, lack of health literacy?
Maybe that makes more sense.
Take out, don't see, understand, need to see the doctor. If we replace that with misinformation slash lack of health literacy, it gives us a much more specific insight as opposed to just don't understand, need to see a doctor.
Would the option don't know how to find doctors, would that fall under health literacy as well?
Anything could be under health. No,
Right.
no, I think that could stand on its own because
How do you not know how to see it, find a doctor?
yeah,
I feel like-
I don't even know if we should be asking that. Like,
I
is
think
that
it would
relevant?
help to look at the priorities again, for me personally.
I mean, pretty much there are health centers in most of the towns, and everybody understands that's how you find a doctor. Now, if you don't have the insurance coverage to go to that doctor, that's a
That's
completely
a
different
different
thing.
story.
Right.
Then you're back under the no insurance.
I don't
Right.
think we need, personally, I don't think we need, don't know how to find a doctor as a choice. And I think we can replace, don't understand the need to see a doctor with misinformation slash lack of health literacy. Because then you also in the next column have lack of availability of doctors, which I think is more of a true problem than
Then find a
not
doctor.
knowing how to find the doctor because they're not out there to find to begin with. What does everyone think of that?
I think that's a good compromise.
What does everyone think? Sounds good, agreed. Okay, good.
Got one thing decided. See?
Okay. What types of healthcare screenings and or services are needed to keep people healthy in your community? You provide care to, check 5. Again, these are disease specific. Disease outbreak prevention, that's interesting.
I do just want to say, just in case people have to
Oh, yes,
hop
it's
off,
3 o'clock.
it is 3 o'clock.
All right,
So we are going to be reviewing this again at our next meeting and coming to a consensus on it. So there is time to
yes,
review it. Jen asked that in the chat, so I just wanted
yes,
to address that.
yes. So, yes, look at this very closely. I'll send out the one sheeter about the 5 priorities with all the focus areas from the prevention agenda. So you have that as a reference. What, do I have anything else to say? I talked about, this was just the timeline. If everybody was on that call yesterday, you saw this timeline. We know what this is the state's timeline. My timeline is for us. And that's it.
And then that was all.
It was a long meeting. I knew it was going to be a long one. So Tuesday, November 2nd, we meet again. We're going to come to a consensus on the CBO survey. We've got our consensus on our individual survey. We will send that out to you all cleaned up. And we'll send this summary of this meeting and we'll see you again on the 2nd. All that Chaz.
Thank you. Bye.
Thank you, everyone.
I'm gonna do that every time we have a meeting. I'm gonna keep
Thanks.
see my lyrics.
Goodbye, everybody.